Hello, my name is Mauriele, and today I'll be walking you through Mr. David Nazar's condition and how his COPD is being affected by his COVID-19 infection. We'll take a closer look at what chronic obstructive pulmonary disease is and why it's so important to carefully manage Mr. Nazar's oxygen therapy and medications, such as salbutamol, ipratropium, prednisolone, azithromycin, and Paxlovid. I'll also go over through the key considerations and assessments nurses need to make before and while administering these treatments, as well as potential side effects to ensure we're doing everything we can to support Mr. Nazal's recovery. In the case study, Mr. Nazal's airway is clear and patent, meaning he can maintain his own airway. However, his breathing assessment reveals increased work of breathing, with a respiratory rate of 30 beats per minute indicating tachypnea. His oxygen saturation is at 78 on room air, suggesting hypoxemia. Upon auscultations, diminished breath sounds, wheezing, and crackles are noted. All signs of respiratory distress likely due to his COPD exacerbation. The crackling sound suggests a buildup of sputum, indicating potential lung infection. If left untreated, the buildup could obstruct his airways further, lowering oxygen saturations and worsening gas exchange. This could then lead to chronic hypoxia, a common complication of COPD, and result in carbon dioxide retention, as reflected in his blood arterial gases or ABG results in room air. The reduced partial pressure of oxygen or PaO2 and pH levels in his ABG result may indicate the onset of respiratory acidosis. Patients with COPD often develop respiratory acidosis due to the impaired gas exchange in the alveoli, leading to elevated carbon dioxide or PaCO2 levels and acidity of the blood. This condition manifests with symptoms such as wheezing, shortness of breath, anxiety, and confusion, all which Mr. Nazal may be experiencing. A chest X-ray further explained Mr. Nazal's symptoms, showing hyperinflammation of the lungs, another common feature of COPD exacerbation, according to the 2024 study in International Journal of COPD by Koopman. Hyperinflation may result from airway obstruction and reduced lung elasticity, trapping air inside the lungs during expiration. This incomplete inhalation leads to shallow and rapid breathing. Inadequate inspiration and expiration contributes to the low PaO2 levels, trapping CO2 and causing the pH to drop, resulting in acidosis. Clinically, this is reflected in Mr. Nazal's elevated heart rate, 128 beats per minute, and blood pressure of 168 over 85. His cold extremities, delayed capillary refill, and high temperature suggest poor peripheral perfusion and the activation of the sympathetic nervous system or SNS, likely triggered by chronic hypoxia, respiratory distress, and anxiety. The inflammatory response characterized by his elevated heart rate and blood pressure and fever is likely due to the combination of COPD and COVID-19 infection. On to high priority nursing interventions and my rationale behind these integral interventions. Oxygen therapy is a commonly used supplement as a treatment for acute and chronic hypoxemia and COPD. Mr. Nazal's oxygen saturations are significantly low, 78% on room air, so administering supplemental oxygen aids to increase O2 levels in his blood. This promotes gas exchange and reduces the risk of further complications of hypoxia, such as organ failure. Oxygen therapy is essential, maintaining ranges between 82 and 89% for COPD patients to prevent oxygen toxicity and worsening of CO2 retentions. Administration of bronchodilators, such as salbutamol, ipratropium, helps ease the airway muscles and reduce bronchospasms that constrict Mr. Nazal's ability to obtain proper amounts of oxygen. This agent allows for easier airflow, improved ventilation, and reduced work of breath, or WOB. This medication is vital for relieving Mr. Nazal's symptoms of shortness of breath, use of accessory muscles, and preventing further respiratory distress and decline. Administration of corticosteroids, such as prednisolone, to reduce inflammation in the airways, diminishing swelling and mucus production, which can improve overall lung function and prevent further obstruction to the airway. This intervention is particularly important for managing exacerbations of COPD due to the infection by COVID-19. This helps control the inflammatory response and prevent further deterioration in lung function. Regular assessment of respiratory rate, lung sounds, and blood gas results is essential to evaluate the effectiveness of these interventions for Mr. Nazal. This helps guide treatment decisions and prevent complications like respiratory acidosis, especially as he's at risk of CO2 retention and respiratory failure due to COPD. Tracking changes in the ABG, PaO2, PaCO2, and pH levels provide critical data for informed decision making. Onto the therapies and treatments and how they are administered, assessed, and side effects that may affect Mr. Nazal's health. Oxygen therapy is essential for managing respiratory difficulties. It safely increases oxygen saturation levels using devices like nasal prongs or Hudson masks. Oxygen flow should be adjusted as needed. Monitoring Mr. Nazal's oxygen saturation (SpO2), respiratory rate, breathing effort, use of accessory muscles, and ABG results is crucial to ensure his oxygen levels stay within the target range of 88 to 92% for COPD patients. Watching for signs of oxygen therapy such as headache, confusion, shortness of breath, and CO2 retentions, as excessive oxygen can worsen respiratory acidosis and dry up nasal membranes. Salbutamol or Ventolin is a bronchodilator delivered via an inhaler or nebulizer. Correct inhalation technique is important for maximum effectiveness, and a spacer may be recommended with a metered dose inhaler or MDI. Before and after administration, assessing Mr. Nazal's respiratory rate, lung sounds, and wheezing. Since salbutamol can cause tachycardia, monitoring his heart rate is also important. Common side effects of salbutamol include tremors, palpitation, tachycardia, headaches, and low potassium or hypokalemia. Ipratropium, another bronchodilator, often used with salbutamol for enhancing effects. It's administered through an inhaler or nebulizer. Proper inhalation technique is crucial to ensure effectiveness. Monitoring Mr. Nazal's lung sounds and breathing for any signs of improvement is important. Common side effects include dry mouth, cough, and throat irritation, especially in elderly patients. Watching for urinary retention due to its anticholerogenic effects as well. Moving on to prednisolone. Prednisolone is an oral corticosteroid that reduces inflammation but can suppress the immune system, increasing the risk of infection. It should be taken with food to avoid stomach irritation and ulcers. Regular monitoring blood glucose levels, especially in diabetic patients, as it can cause hyperglycemia. For long-term use, it can lead to weight gain, high blood pressure, osteoporosis, and gastrointestinal upset. Azithromycin or Zithromax is an antibiotic that can be taken orally or via an IVF, depending on the infection severity. It's important to complete the full course of medication to prevent antibiotic resistance. Monitoring liver function, as antizithromycin can lead to hepatotoxicity. Common side effects include nausea, vomiting, diarrhea, and possible arrhythmias. Paxlovid is an oral antiviral treatment used for COVID-19 infections and should be started as soon as possible after symptoms appear for maximum effectiveness. It can be taken with or without food, but must follow a strict schedule. Monitor renal and liver function before starting, as dosage adjustments may be needed for those with impaired function. Ritonavir can interfere with the metabolism of other drugs like anticoagulants, antiarrhythmics, and statins. Common side effects include altered taste, diarrhea, headaches, and hypersensitivity reactions may also occur. By considering these factors and key elements to the following nursing interventions, Mr. Nazal's care plan can be tailored to ensure treatments are effective and efficient, whilst minimizing the risk and possible complications that may further exacerbate his conditions. Thank you so much for watching, and have a lovely day.